Hey, everybody, and welcome to another edition of the Migraine Mentors Minicast. I'm one of your migraine mentors, Dr. Erik Reis. And this week's episode is talking about hormones and migraines. If you are somebody who's been dealing with chronic migraine, you know this tale probably far too well. Unfortunately, it's usually because it's something that surrounds either your menstrual cycle, whether it's before it, during it, or in some cases, weirdly, even after it. I think this is a really important topic for us to discuss because so many people have been led to believe that they're just at mercy to their hormones or they're just at mercy to their, genetics. While some of that is partially true, that's not really the full story whatsoever. And that tale, unfortunately, really doesn't give you autonomy into whether or not you actually have a choice in the outcome. So today we're going to talk about this whole complex because it's so prevalent and so important. And unfortunately, for so many of you out there who, statistically speaking, 4 to 5 of those listening to this podcast are probably women struggling with migraine. And most of you are going to struggle with menstrual migraines in some way, shape, or form. This is a really important topic for us. So let's just kind of get into it a bit. Like, why do hormones actually matter for migraine? Well, hormones play a pivotal role in so many aspects of our life, but especially for migraine, we're really talking about estrogen and progesterone. These aren't just reproductive hormones. They can actually influence like blood vessels, they can influence neurological function, they even influence neurotransmitter production like serotonin and dopamine. They're really important for us for so many reasons, but unfortunately, for a lot of women, especially women who struggle with migraine, changes in these hormones can actually tip you into a full-blown migraine attack. It can trigger auras, it can trigger the inflammatory cascade, because here's how this process works. The estrogen levels will usually, statistically speaking, drop before menstruation. That's if you have a normal menstrual cycle. For those of you who do, congrats. For those of you who don't, another part and piece of the puzzle. But what happens is this fall will actually affect serotonin production, which can actually increase instability inside the brain, and it can actually cause sensitization to pain. We also know that there are progesterone changes that occur throughout this cycle, and that can also trigger things like inflammation. It can alter how your brain processes stress responses. It can change the way that your brain allows you to get deep restorative sleep. We also know that these hormone fluctuations inherently just trigger pathways that are commonly involved with migraine, specifically talking about this trigeminal vascular system, which is this system that allows blood flow to the head and to the brain. We also know it affects specific releases of CGRP, this calcitonin gene-related peptide. This is a thing you'll find in Abrevely where they're kind of having essentially building a mechanism where they're trying to block the receptors for CGRP, and that will stop a migraine from either occurring or prevent it from occurring. And so, as simple as this sounds, it's really not, right? We know that there's a lot more to be said about that. 2 days before a period and the first days after menstrual bleeding, we know that migraines are probably more commonly to be attacked and be triggered. We know that ovulation can be a trigger, especially when estrogen levels start fluctuating. And even when we start getting into like things like perimenopause or even menopause, we know these changes in estrogen can be really impactful on migraines, on migraine attacks, on triggers. And menopause is kind of this interesting complex because the years leading up to menopause, it's pretty notorious for being very irregular with hormones, hot flashes. You talk to any woman who's gone through menopause, and they will probably inherently be telling you a very interesting story about things that have changed in their life. But it doesn't always have to be that way. We know that these hormonal changes can inherently trigger or fluctuate with migraine attacks. But here's the good news. Take it with a grain of salt and the silver lining with menopause, as destructive as it can be for so many. We know is that once people reach full-blown menopause and estrogen levels have actually fluctuated, there can sometimes be benefits for individuals to see decreases, if not complete elimination of their migraine attacks. But there's always a caveat. And of course there is with this. If you are on hormone replacement therapy, if you're doing something to modulate your hormones, that may not be your tale. It's really important to understand the type of hormones you're being used. It's also important to understand the type of delivery that is being administered for those hormones. And so it's always important to kind of take that as a caveat. But you have to understand that if you're somebody who's struggling with like menstrual migraine, that doesn't necessarily mean that has to be your tale. This isn't a genetic predisposition. This isn't something that you were born with. A lot of times these things are acquired. And do genes play a role? Yes, but a small caveat, right? So if you look at the saying, the genetics load the gun and the environment pulls the trigger, you're essentially looking at, yes, you have this genetic blueprint for whether or not you're going to be predisposed to something, but it doesn't necessarily mean that you're going to. And cancer studies, twin studies have proven this time and time again. Your environment is a massive factor for selecting which genes you turn on and off. And it's not just the environment, it's the things that you do or you don't do. So, with that said, let's get into some practical strategies for helping you manage these hormone related migraine issues. One of the first and foremost things that we always suggest clinically with our patients at the Neural Connection is to track your cycle and your symptoms. Sometimes those correlations can show us a little bit more about what's actually causing your symptoms. And although correlations don't always equate to causations, they can show you patterns. And those patterns can be really effective for helping you understand triggers, reasons for why you feel the way you feel, and then more importantly, too, hopefully finding ways for you to be able to find solutions for your symptoms. The second thing I would suggest is looking into your blood sugar levels. What we're finding with patients clinically is that those of you who have these fluctuating blood sugar levels oftentimes have more inflammation, you have more triggers, you have more food sensitivities. By balancing your blood sugar, you can balance the neurological systems that are involved with migraine. And it's as simple as eating things with really high quality fiber, quality proteins, healthy fats. That combination is really beneficial for your brain and your body and your gut microbiome, which we're consistently learning more and more about, especially with migraine patients. The third thing is looking into supporting your energy metabolism, specifically with estrogen. It's interesting looking at the data. Dark cruciferous leafy vegetables, things like broccoli, kale, Brussels sprouts, high quality fiber, and adequate hydration with electrolytes can actually support your body's ability to manage and buffer estrogen levels in a very therapeutic way. We also know that having too much belly fat can also be destructive for that kind of visceral body fat and that cutaneous body fat. They both play a role in storing toxins, being able to manage blood sugar levels. But we know that fat can be very pro-inflammatory as well as pro-estrogen. So those men who get man boobs or have issues with an excessive amount of fat, they actually are aromatizers. They take testosterone and they aromatize it with a specific enzyme to convert it to more estrogen. That may be an issue for you if you are a female as well. You could have too much or too little estrogen just depending on your makeup. And so it's something to really consider. And it's a really important mechanism because it's also going to help you just live healthier. Another factor is making sure you're getting enough magnesium. We've talked about this ad nauseum at the Migraine Mentors. And so we're so keen and bullish on magnesium. 50% of people in the population throughout the world are considered to be magnesium deficient. So if you're not supplementing with it, there's a high chance you're not getting enough of it through your diet, through maybe even supplementation. So just take it as a supplement. We like magnesium threonate because it affects the brain and crosses the blood-brain barrier, but magnesium glycinate and magnesium citrate are also great combinations. If you don't know what kind of magnesium to take, you should just take them all. You're going to benefit from it. Your brain will, your body will. So you're going to see the beneficial changes with that. Another thing is making sure that you are prioritizing your sleep. Now, I understand the irony of saying, hey, you should just sleep more when you're struggling with sleeping more. So what I'm going to tell you is that sleep and having issues with sleep is not inherently a deficiency of like Lunesta or a medication. A lot of times what I'm finding clinically is that people really need to do an inventory about the sleep habits that they have at home. Are you eating too late to bedtime? Yeah, that's an issue for you. Are you drinking too much water close to bedtime? That can also be an issue for you. Are you staying up late at night, staring at your computer screen or being in front of bright lights? Your brain gets this awakening response, which suppresses melatonin production, which essentially tells your brain to stay up and it continues staying awake. So many sleep habits can compound over time to help you actually get to sleep. And there's some really interesting data in the cognitive behavioral therapy space that is essentially pointing to how your bed should only be used for two things: sleep and sex. So if you're not using your bed for those two things, you should be out of your bed. If you're meditating or doing yoga or reading at night, it should not be in your bed. It should be on a bedside chair or somewhere away from your bed, because you should only associate that with those two factors. And as silly as that sounds, that's actually what a lot of the cognitive behavioral therapy techniques will teach you and coach you on. So we know that sleep is an important factor. And last but not least, if you can't get all of your nutrition from your food, then take some targeted supplements. We already talked about magnesium, but B vitamins, specifically B2 riboflavin, is a really important factor in affecting and improving migraine function. Now, for me, selfishly, I think most people should just be taking a methylated B complex. Why just take B2 or B5 or B6 or B9 or B12? Let's just take them all. It's water soluble. You're just going to pee out all the stuff you're not using. It might turn your pee a little weird color, but who cares, right? You're getting all the nutrients. Because on top of that, we know that free fatty acids like fish oil are really important, and CoQ10 can be a really important factor for helping people overcome migraine. All of this wrapped together, combined together with this, can help you get through your migraine symptoms. It's just going to take a matter of trial and error and personalization. Now, these are kind of considered cookie cut approaches, but a lot of them are really tried and true, and the research is quite rife on this. Otherwise, we wouldn't be presenting it to you. So with that said, now's the time for you to try this. If you're somebody who's tried a couple of things, maybe it's time to try some other things. If you're somebody who's tried everything in the book, then maybe it's time for you to reach out to somebody who's a specialist in this space. At the Neural Connection, we see patients from all across the US. We've seen people internationally, and we've helped a lot of people overcome their migraine issues by running blood tests, integrating with their providers, challenging the narratives, and more importantly, too, just really developing personalized programs. So if you are somebody who is a subscriber to the Migraine Mentors newsletter, thank you for your support. We wouldn't be here without you. If you're somebody who just stumbled across this video on YouTube, Spotify, or one of the other channels that supports our podcast, then what are you waiting for? If you're looking for actionable tips, tricks, and non-invasive integrative aspects to trying to help you overcome your migraine symptoms, we deliver it every Wednesday morning at 6 a.m. Central Time. So we've taken 20 years of our clinical expertise and wrapped it into this newsletter to help people like you overcome your chronic migraine symptoms. So with that said, thank you for joining us, and I hope to see you again at next week's episode.